Couples may realize that there is a problem with ovulation if a woman's menstrual cycle is not occurring regularly. This might sound obvious, but many women do not track their menstrual cycles and are not aware that their cycles are not occurring regularly. A regular menstrual cycle means that a woman is seeing her menses every 21 to 35 days apart. Generally, however, the variation from cycle to cycle is less than 5 days. And generally, the cycle length is at least 24 days and generally less than 35 days. If the cycle is coming much earlier than that, then that is an indication that ovulation may not be occurring. And similarly, if a cycle is more than 35 days apart, that is another indication that ovulation either may not be occurring or is occurring less frequently than normal. So the first step in detecting whether there's an ovulation problem is to track the menstrual cycles and see how frequently they are becoming. It's important to note that the menstrual cycles are tracked by noting the first day of an actual flow to the next cycle when a first day occurs. So we don't track beginning after the menses ends, but rather with the first day. Some women are confused because they experience spotting. We consider the first day when there is an actual flow. So from the first day of an actual flow to the next first day is what the cycle means and what we use and refer to as a normal menstrual cycle. Ovulation generally occurs approximately 14 days before the next menstrual cycle. Since that means that we only know in retrospect, by looking back, when ovulation occurred, it's important to be able to track and determine prospectively or before ovulation occurs so that we can know when the proper timing to try to become pregnant would be. That can be accomplished by using ovulation predictor kits. These are kits that can be purchased at the store, and using urine can tell or detect when the ovulation is going to occur based on the amount of a hormone called LH in the urine. There are other tracking methods, and many women are now using apps on their phone to help them track. But again, those apps are looking at previous cycles to try to give an idea of when ovulation should be predicted to occur, but are not going to be as accurate as using an ovulation predictor kit.